Welcome, everybody. Fernando, do you want to get started?
Okay, welcome, everybody. I am Fernando Salvetti. I'm mainly with LogosNet and no conflict of interest to declare. So please, Roxanne and the other faculty.
Okay, I'm Roxanne Gardner. I'm an OBGYN physician. I'm based in Boston, and I've been at the Center for Medical Simulation since about 2002. Rebecca?
I'm Rebecca Meinhardt. I'm an OB anesthesiologist by my clinical background, practicing at Massachusetts General Hospital, also in Boston. And I've had the distinct pleasure of working with Roxanne since about 2006 at the Center for Medical Simulation when I was a fellow. And then also with Barbara and Fernando for the past 5 years or so. Barbara?
So welcome everyone. My name is Barbara Bertagni. I'm a psychologist, co-founder and managing partner of LogosNet with Fernando. Happy to be with you today.
It's really our great pleasure, and we would like to share with you our experiences about augmented and virtual reality and interactive visualization for an effective team working. So our focus today is team working, and at the same time is how to use augmented and virtual reality in order to let's say, foster and empower simulation experience devoted to really boost our teams at work. Let me share with you just an only slide, is the only one about our background, because there are 3 keywords we are in need to be aligned with: augmented reality, virtual reality, and mixed reality. Today, we are mainly focusing virtual and augmented reality in a way that keep into our focus both the purely digital experience, means the purely virtual reality, as well as another dimension based on virtualization and based on augmentation that is called hybrid reality. So those are the keywords for today. And let me start, or better chat with you, starting with a question. I'm writing right now in our chat. And I'm sharing with you all. Would you like to use AR and VR without special glasses or head-mounted displays? Because VR and AR are not necessarily linked or in need of glasses, Google, wearable augments. So we would love to read some answers, because it's a good way to be aligned and to understand if we are into the same page or not.
Many people saying yes. Oh, one person says glasses preferred.
Glass preferred. Good to know. So we have at least different opinions and different preferences. From my side, personally, I'm mainly fine with skipping glasses. This type of question opens us to what we are mainly expected to share with you today, that are experiences. We have short recordings from 2 types of experiences, very different experiences, both online and into a physical environment. In both cases, skipping glasses. So what we are mainly sharing today are different experiences without glasses, and we are open to talk and to discuss about using or not glasses. We have a couple of times expected to be opened to chat, question and answers, because it's a new frontier into the virtualization and augmentation of our medical simulation experiences. Let's take very quickly a look at different possible settings like this. Virtualization because there are images, videos projected onto the walls. Something is happening inside the rooms. Something is happening onto the walls at the same time. So virtualization and augmentation. Augmentation is when something, for instance, is overlaid, is written, like here, or like here. Vital signs, medical imagery overlaid into a virtualized environment made by brick and mortars, at the same time made by 3D images. The setting, the more in general, the settings, the available settings known to us today. A typical brick and mortar setting, maybe with a patient simulator. The entire room is projected. So the context is within the learning setting, thanks to projections that are interactive projections. So virtual reality, sometimes overlaid with information. So is augmented reality inside a virtualized setting. This is another example on my right, looking at the screen. So there are screens, there are projectors, there are interactions, tactile, gestural, and sometimes vocal interactions. Same setting, going down, but portable. Not really a brick and mortar, but a styrene and iron made setting, a portable pop-up, let's say, to perform, in all those cases, medical simulation in an augmented and virtualized way, because this is the merging of the real and the virtual world into settings that sometimes we say as phygital. Physical and digital is the merging of two very different meanings inside an only and unique word. This is purely a digital word. This is not at all physical and digital. This is a replica of a physical word, but is an entirely and purely digitalized word. A platform, let's say. And those are the main features available into the platform as well as into the real world. You can see those guys by the flick of their hands with medical imagery. It's a puzzle, it's about a brain cancer. This is a checklist we are expected to interact with and to learn about in a few seconds from now. And those are the main available features, both into the virtual platform as well as into the phygital settings we are used to install and to use in order to deliver medical simulation based on virtualization and augmentation. This is, again, the purely virtual and virtualized setting is an online platform. This, with a video embedded, comes from IPSV, the International Conference about Pediatric Simulation. Was held last December, totally online. And we had the chance with Roxanne Garner to work inside this platform with some attendees that were available to perform directly the checklist and mnemonic known as name, claim, aim. And I leave the stage to Roxanne because she was the main faculty leading this experience. So in my opinion, she is the person that may share with us thought about the experience, feeling about the experience as well. Please, Roxanne.
Okay. Thank you, Fernando. That was wonderful. Sorry. So this video is actually 6 minutes, and we are not going to display the whole 6 minutes of this video, but really highlight some key examples from the conference that were really interesting and I found very impactful for my own learning. I had never previously worked with a fully online platform until the past pandemic year, which forced us to move from a physical space, digital, to a completely digital, right? Fernando, if I use the terminology right?
Oh, yes.
We will actually, after this example, we'll show you the digital, the pre-COVID experience when we could all gather much more freely. So at this conference, IPSS, Fernando was able to display the eReal online platform, and I served as the MC and gathered people who are participants to embark on a scenario experience with me. So Fernando, if you want to play the first.
Yes, and let me know when I have to stop, please.
Okay, or jump. I'll tell you when to jump.
This is Pavan. I'll step up.
Okay, Pavan, great.
Bram, I'll play too.
Okay, Bran, wonderful.
This is Catherine. I'll play also.
Okay, you got a little bit of a team here, Pavan, going. So
let's try AE. No idea what that stands for.
AE.
Oh, stop there.
Marjorie, I'm on your team too.
Fernando, stop for a minute. So just to explain this room a little bit, the space has three walls, and activities can happen on all those three walls. So you see the logos on the side walls, and then in the front, you see our wall where we actually have various options for scenarios that participants can pick. So in this particular set of scenarios, some of them are truly clinical scenarios, more healthcare related directly. And some are situations in which one would find themselves possibly in an environmental surprising situation, such as, for instance, tornadoes or lightning strikes, or finding somebody collapsing on the sidewalk. And each one of these are abbreviated with initials so that it doesn't give an overt clue as to what is the scenario. So we have our participants actually have the opportunity to pick the scenario that they're going to work with. And then the point of this exercise really was to help them learn the technique or paradigm of organizing a team called name, claim, aim. And Rebecca will go deeper into that shortly. But so you'll begin to see the team I've recruited from the participants have stepped up, and it was their terminology that they used to choose, I'll play. And so that sort of made me feel really, it made it much more fun. Like, yes, we're gonna actually come into this room and play and engage together. So I really enjoyed their choice of words. And these are people who may or not know each other. They were just attending the conference and decided to step up and play. So I think that sets the stage a little bit. And Fernando, I think you can continue on.
Awesome. Okay. So I guess trying to apply the name, claim, aim role. Name would be that we're out in the wilderness, and if something were to happen, let's try to claim some roles. And I guess since I'm continuing to speak and I started, I'll be the event manager. Catherine, what role would you be able to take?
I can do CPR.
Okay. And Bram?
I can do airway. I'm the one person who has a little mask here in my pocket.
And I'll do circulation or stabilization of acute injuries that might occur.
Okay. If I could have one more person help out with calling for help, because I think out in the wilderness, that'll be more important than any of these other things.
I'm wondering about equipment. What emergency equipment might we have thought about that we have already? I could also manage equipment that we have, like our first aid kit, our satellite radio.
Roxanne, do we have any equipment or?
You don't have a satellite radio, but you all have your cell phones. I'm not quite sure what the signal is reachable in this wilderness area, but I guess you'll find out. And there's at least a couple of you who thought ahead and had first aid kits.
Excellent.
Okay, typical for what you would do with hiking. You ready to start the video?
Sure.
Okay, ready to go on the hike.
So there's water.
Okay. Lots of different things could definitely happen here.
Okay, pause it right there.
If you could pause it right there, Fernando.
So.
Okay.
Good. So the group was, the interesting and unique thing about this group is that they decided that they wanted to huddle together first before they embarked on their hike, because they had an inkling that something was going to happen. And I really enjoyed their pre-planning and assigning roles ahead of time. I think that really stood them well. So Fernando, maybe you can jump forward, maybe about halfway between that and the end.
Until here, I start again.
I would like to do a little further assessment. Is it pulseless? Does she have a pulse?
She has a pulse. She's responsive. She's screaming. She's crying and moaning.
Okay. So I'm reporting back the information that we found in our assessment to the leader. The question, I guess and I'm wondering if it seems like she might not be able to walk and continue on with us. So we need a plan. Thinking the next step might be to get a plan for how we're going to get her out of here.
Okay, I think you can.
And so Marjorie, if you could call for help, can we try?
Oops.
Yeah.
Sorry.
That's all right.
Okay.
So I think people can get the idea that it was very interactive, even though we're all in the digital arena, and they were taking it seriously, even though it was fun and they used the terminology game. But once they were engaged in managing this situation, they really gathered their team together to identify what was the appropriate plan for managing this event. At the end, we had a debrief, and the feedback they gave was very positive. And in the interest of time, I'm going to not go through that. But Fernando, if you could go to the next slide.
Yes.
So we have been working with this paradigm of name, claim, aim in our labor and delivery crisis management teamwork courses. And this particular scenario is one in which we are pre-COVID. We're all still allowed to gather together. We didn't even know what was coming around the corner of the year, so to speak. So thus you see us all close together in a small space. The thing about the eReal physical presence is that it can adjust to the size of the room. So this room is actually rather a narrow room. And had I had my druthers, I would have rather had much greater space for people to move around. But that said, we got a lot of mileage out of this small area. And for our eReal room, we had two walls that were interactive. So Fernando, if you could point to the two walls with your mouse.
Yes, this is
It's one big long wall, but there's actually two
split in two.
Yeah. So they can function independent of each other.
Yeah, because there are different projectors here in different systems, making the wall interactive.
Right. And then the back wall was just a regular screen projector. It didn't have the interactive capabilities. So our future plan had been to create a room in which the real three walls, front, back, and the sides, were all interactive. And we just never got a chance to get quite there. But I want to show you a little bit of a clip of how we use this in our labor and delivery teamwork courses. And all of these folks are experienced clinicians in obstetrics, whether they are midwives or obstetricians or anesthesiologists. And most of them were not really involved in any kind of online gaming activity. So you might see a little bit of nervous giggling happening in the beginning. So Fernando, if you want to.
Okay, so which two people want to go first?
I'll go first.
Okay. Okay. Count two. Let's do it. Now remember, you can just stand up here. Okay. Oh gosh. Okay. Do you need car accident? Do you need to see it again? No, I don't think so. Do we need to stop it?
Oh, okay. So there was a car accident. The car was coming on, hit that other car, swerved out and went over. So I need an event manager. Oh, I saw it. Do I have to? You can appoint somebody. Okay. Jim, you want to be event manager?
I'll be the event manager.
Okay, cool. And what else?
Jim? I'll be the event manager.
So
I need your help.
I'll be the event manager. I need your help.
These are all people in the car with you that were driving behind us. Yeah, all of us.
I'll call 911.
Okay. Can somebody go check on the people in the car?
Yeah. I'll do that.
Okay.
Fernando, let's stop and let's just
somebody.
Oh, it's almost over. Go ahead, keep playing it.
Okay.
Yeah.
Maybe put up something to warn other cars so we don't have more accidents.
I got flares.
We can go
Flares. Oh, not flares. Good.
Oh, should we flare up?
There was the other car. I can go look at the other people in the car if it's safe to cross.
Okay.
All right. So those were the good old days when we could really gather together and have a fun interactive session and have some opportunities for deliberate practice in helping people to learn this technique of organizing a team. So at this point, I'll toss it over to Rebecca, my colleague.
Actually, I think Barbara's going to say a couple words.
Barbara, right.
Yeah,
so,
yeah, that's fine.
Thank you. Barbara.
Oh, Barbara, you're on mute.
Barbara, maybe
Thank
you
you, Rebecca. Okay. Teamwork is essential for the safety in most work environment. Especially for healthcare teams that used to operate in complex, dynamic, and highly stressful work environments, such as emergency medicine. So our main questions are what makes teams work and how we can really improve team working. And this is a way we work on teams, allowing teams to work really together. This is one of the reasons why we prefer having a real space or also a virtual space with a real team working together. We prefer this instead of having glasses that make people a little bit alone in a wonderful scenario with 3D effects, very realistic, but losing the power of the real team. And if I try to summarize with 3 words, what we try to do in the real is letting people interact in the best way possible, visualize with very engaging and very nice visualization that allows a 3D visualization on the screen with our glasses and engagement that we think is the key for learning. And the focus is in letting the team becoming aware of the way the leadership is explaining the team, the way they communicate, the way they use the words to express each concept, and the way they make decisions. That is truly important. So we think that in this kind of environment, people can communicate in a real way, and people get emotional also in a real way, because this kind of situation really make people work under a lot of pressure. And this is the main goal, if I have to summarize. Rebecca, I leave you to explain us better something about a name, claim, aim.
Yes, thank you so much. So yes, perfect. So for those of you intrigued to know more about how we teach name, claim, aim, and what is this paradigm, it's essentially what we have designed as an easy to remember mnemonic. Name, claim, aim, it rhymes, it's 3 words, but it collapses all of the really important teamwork behaviors into, again, something simple and easy to apply. And I think that using the virtual reality environment that we had, the augmented reality environment that we had with eReal has been phenomenal to help people practice this. Our prior model of having people go into a simulation and sort of just try to work on teamwork skills together, it was a little frustrating as a facilitator, because I think these things are really complicated and we didn't have a really streamlined approach to how people can think about this and apply all of these skills. So there's a question that I'm just going to take really quick. If this is a team from OBGYN, obstetrics and gynecology, what are the pros and cons of training name, claim, aim on a car crash versus something more close to their normal work? Roxanne, do you mind if I take this really quickly, because I had some thoughts and then you can add? Is that all right?
Sure.
Okay. So I also teach labor and delivery teams, as well as anesthesia teams and OR teams, and we use name, claim, aim. What was really interesting was that when you use it in a normal situation, many people, a non-medical situation, many people then suddenly got this idea that, oh my gosh, how useful is this? It's useful not only in medical crises, but also I can do it for other things too. And I feel like the skills of distilling down, we'll go into each of the buckets here, but the name is sort of a crisp, just a one-liner to frame up the situation, to start people thinking together. That I think is probably the most important step in this whole process. And that people could apply even in surprising situations like a lightning strike or a house fire or a tornado came through. And so allowing them to have some practice in non-medical situations, I felt really helped them see the utility of this paradigm. Roxanne, what would you like to add to that?
Well, what I would add to that is that we had a number of different options for them to choose from, and each one was different. They didn't know what the experience was, but we pre-briefed that is what they were going to be walking into. And then pairing them up into teams, they each had an opportunity for a deliberate practice moment to go through the name, claim, aim. But everybody who was around them were members of their team by default. So they had a lot of other people to be able to assign roles to. And the beauty of this is that we did this exercise until every pair of 2 had an opportunity to be going through their name, claim, aim exercise. And then we went into the simulation, the more traditional simulation room. So we had labor and delivery events, whether they were in the labor and delivery operating room or in the antepartum or labor room or postpartum setting. And I found anecdotally, and we've been gathering information, but the application of the name during the oops, if I could have someone
something is happening. Okay.
There we go. So, so anyways, as they went in to manage the simulated obstetrical event, there seemed to me to be a greater or quicker application of the name, claim, aim for managing that event. So I turn it back to you, Rebecca.
Yes, sure. So Fernando, do you mind going forward on the slide? So I'm just going to walk you through how this sounds in real life, how I demonstrated, how Roxanne demonstrates it, I think, too, and how then we ask the teams to apply it. So it starts off as, you know, you're going through your normal day, and then suddenly there's, oh no, there's an event. So Fernando, can you click next? Oh no. And then next is when something happens that people feel like rises to the level of needing extra help, or it's starting to turn into a crisis or a critical event or some situation, then we ask them to call for help. And the first thing we ask them to do is name the situation. And so, Fer, can you, next, please? And again, next. So naming, we ask them to say whatever is succinct and it's almost like their working hypothesis. So the data, the signs and symptoms the patient has, and then what you think it is. So for example, if I were taking care of a patient in the operating room, I might say, I have a patient with low blood pressure and we have a problem. The patient has low blood pressure and is very, very fast heart rate. I think it could be any number of things. My top three differentials are, is it an anaphylaxis? Is it hemorrhage? Is it, sepsis? So I might have a working list and I may not know the exact answer. You can say if you think the leading diagnosis is this, but you're leaving yourself open to getting information from the team, because often there's a lot of uncertainty when things are happening. And even if you are even if you feel certain that you know what's going on, I have found myself to be, you can't see everything. So it's important to leave yourself open to modifying your working diagnosis. And if you go next, and then the next step is the claiming. So claiming roles. The first one you heard in the videos, somebody said, I'll be the event manager. That could be a leader. You could call it something, whatever you want, but this person is the person who is usually narrating and organizing things and helping the team see the bigger picture. So it's very important for this person to be inclusive. So asking questions, getting feedback from the team, using their suggestions. Those are all hallmarks of inclusive leadership. Being humble to an extent where you have to make decisions with your team. You can make decisions, but really being inclusive. So that person would say, I'll be the event manager or the leader. I need your help, okay? So it's inclusive, it's contracting. And then the rest of the roles can be doled out or they can be claimed by people. You heard in the video, somebody said, I'll call 911. That's okay, that's a role and it's also a task. And Fer, can you go forward, please? The last step is to aim the team. So the overarching goal and the next three important steps are what we usually like to have people say in the aim. And then also asking, what other ideas do people have? Please share ideas. We need everybody's thoughts on this. This comes in cycles. So name, claim, aim is designed to go through cycles. So the first cycle of name, claim, aim might sound different than the next or subsequent cycles of name, claim, aim. So just to so if you go forward we have a little, just go ahead and click forward. Yeah, perfect. So you're renaming, you're re-aiming. So maybe you start out with hypotension and then you progress to pulseless electrical activity, which is worse. So maybe you have a bigger problem on your hands. So then you have to update the team and let them know that the interventions may be more dramatically changed. So that's sort of the way this goes. What else should I add about this? Roxanne, Fer, anyone?
Well, I think the other interesting thing is that to add would be that you might need to reclaim the roles. So very often in obstetrics and gynecology, when we have an obstetrical emergency, somebody may step forward to be the event manager only to find out that we need their hands-on skills. And as soon as they need to dive in and help physically with an operative procedure, they can no longer be the event manager. So they need to crisply and quickly designate someone else, or someone else needs to step forward and take on the event manager role. So that would be a reclaim of roles and dispersing the team in a different fashion, because the situation has advanced or evolved into something more dramatic.
Mm-hmm. So I'm noticing the time. Thank you so much, Roxanne. That's right. So it's a dynamic approach and it can be fluid. We think it all needs to be explicitly said. So multiple studies saying that even if you think it's obvious, it may not be obvious to everyone. It certainly can be helpful if you share your thoughts openly. And so if you want to go to the last, I think it's the last slide.
It's the last, because
yes.
we are only thanking you, but before leaving you, please start with your questions and start with your comments, because we are really in need to learn more from you, your opinions about what we are sharing as experiences, trying to merge virtual and augmented reality into a real working team. Use the chat, or if you prefer, open the microphones. We have 3 minutes left.
Oh, and Rebecca put a question in the chat too. What are your challenges with training teams? That might be another interesting topic to discuss as well.
What are your challenges with training teams? Yeah, please, let us know.
Well, Rebecca, why don't we talk amongst ourselves? What are some of your, what are the challenges of using this form of education with training teams? I think for me, some of the challenges, which are really not a hard challenge, but if in dealing with some of the faculty that I've been working with, they're just not used to this type of environment. And so they initially might feel intimidated going into the eReal system that we had pre-COVID. So there was often a lot of giggling and nervousness. And the beautiful thing is that they all adjusted to it pretty quickly. So I don't really have any pitfalls that I've encountered. And Rebecca, maybe have you had any pitfalls that you've encountered?
Say that it's not a pitfall, it's just sort of a consideration that when we're trying to train this teamwork thing, sometimes, obviously when we're caring for patients, if you're thinking about it in patients settings, then you're thinking about all of the tasks that have to be done. And sometimes physical tasks take more time or they're more complicated. And so right now I'm not using task trainers to augment this. And so there's a part of the work that's not accounted for, but it's more the organizational structure and getting people used to saying things out loud that I think make this really helpful. So if you're looking to do both, I would say that's something that I haven't done as much of. And so that just might be physically to set task trainers out or somehow figure out how to also add some elements of the physical world for tasks that people have to do. There's another question.
Probably the last question looks like it's for Fernando.
Yes.
At least one question I can very quickly answer is that behind the system there are a number of patents, so it's not a projector and it's not an interactive projector, the core of the system. There is a pedagogy and andragogy and a lot of technicalities from LiDARs to different sensors, plus some projectors. But it could be a long talk, so I stop myself here just in case, invite me and I can provide you with more technical detailed info.
The mindset issue, I think I focus them on it may not feel real. Some parts of it may not feel real, but the problems are real. So if you act as if you you're working to solve the problems, then you'll get more out of it. So it takes some time though, and some feelings. Like there's other lots of literature on how do you get people to.
And we do a lot of that work at the beginning of the course in terms of the safety, the psychological safety, the fiction contract. And I think, that really goes a long way to quelling that problem. Well, we're at our time. Fernando, want to close us out?
Yeah, wonderful meeting you guys. Really was a pleasure, and we are available to answer any other further questions by email or as you prefer. Thank you so much for attending this event.
Thank you very much. Bye.
Bye.
Bye-bye, everybody.